Hello, my name is Sara Pilsner, and I'll be doing my head to toe assessment on Kathy Barkbigler today. Um, I just want to start off by saying that before she came in, I asked her if she'd like to empty her bladder, and she did. I asked her if she would like to have a gown on, but we chose to wear this attire instead. It'll be a little bit easier to see. We did a full set of vital signs. We also did a height and weight with that. We also did a distance test using the Stellan chart, and we also did use the Romberg test using the testing for nearsighted vision. Also, um, as I talked to Kathy, she is appropriate with her conversation. She's alert and oriented times four. Her gait is steady whenever she walked in. She's addressed appropriately, and she does have good hygiene. So the first thing I want to start off with, I'm just going to physically just look at her head. So I just want to look at her head. Everything looks fine. It's normal. It's it's perfectly. It's round. Sorry, it is round. There's no obvious masses or bulgings or anything like that. There's no lesions, anything like that either. Hair is appropriately dispensed um, throughout. There's no cracking. There's no dry. There's no redness or drainage or anything like that anywhere that it can be seen, and there's no balding areas at all either. Um, Now I want to palpate her head, see if there's any tenderness.
None.
I want to palpate all of her facial bones for any sort of tenderness, which there is none. Next thing I want to do is I want to palpate her frontal sinus and her maxillary sinus, which there is no tenderness there either. Um, from there, I want to see her temporomandibular joint, if you can open and close. There's no clicking, there's no popping, there's nothing like that that is present for her. Sorry, I'll be making sure that my screen stays bright. Um, so everything there is appropriate. The next thing I want to do is the next thing I'm going to start with. I'm actually going to go back to her face too, and I want to make sure that she can do a few things that have to do with her cranial nerves. So, can I get you to blink your eyes? Can you shut them real tight? Can you wrinkle your forehead? Can you wrinkle it up? There you go. Can you puff out your cheeks? Puff them out like a blowfish. Can you smile? Good. Can you stick your tongue out? Good. Can you clench your teeth together like that? Perfect. Um, those are all appropriate. The next thing I want to do is I'm going to test another cranial nerve, and we're going to do a light touch test. So can you close your eyes for me and tell me where you feel this?
Forehead, left cheek, cheek, chin.
Very good. So all of that is appropriate, and she is able to feel all of that fine. Next thing I want to do is I'm simply just going to look at her eyes right now. I'm looking at them, and they're equal, they're present, they're sitting on her face fine, they're symmetrical. I'm going to look at them and see her lacrimal apparatus. It's not producing any extra tears. Her conjunctivae are pink. Her sclera is white. There's no yellowing at all there. Her eyelashes extend up and outward, and her eyebrows are symmetrical as well. There's no loss of hair at all either. I do want to do a couple things with her eyes. First thing I want to do, I'm gonna have her cover one eye and then uncover it. Perfect. And then cover the other one and uncover it. Perfect. There's no nystagmus. There's no extra movement of the eye that's unneeded, so that is perfect as well. I do want to um, test two other things. I want to test. Oh, sorry. I want to test direct and consensual eye movement. So just look at me. Direct is perfect, and consensual is good. That's direct and consensual. Her pupils are equal brown and reactive to light, so that is good as well. Next thing I want to do, I'm gonna have her follow my pen light as well. This is also gonna check more cranial nerves. So if I can just have you follow this just with your eyes, don't move your head or anything else, just your eyes. Her eyes are able to follow the pen appropriately, no extra movement or anything like that. So that is good. Next thing I want to do is I want to look for her red reflex in her eye. So if I can just have you pick a point on the wall and just stare straight at that. And that is C. And I can see that one as well. So that is appropriate also. Um, Moving on, I'm just going to move on to her nose now. As I look at her nose, it's midline. There's no redness, there's no masses, there's no bulging of anything. Um, whenever I when I palpate it, there's no pain, there's no tenderness, nothing like that. Can I have you look up? The turbinates are pink. Her septum is not deviated at all that I can see. Can I? I'm gonna check her patency. I'm gonna have her occlude one nostril and breathe. Perfect. And the next one and perfect. So that is all. That is all fine. Also, next thing I want to do is I want to look at her ears. So as I look at her ears, they're midline. On her head, nothing is drooping. No, neither one is drooping either way. There's no drainage. There's no redness. There's no obvious masses or bulging or anything like that I can see. I'm gonna palpate the auricles. There's no pain or tenderness there. I'm gonna look in her ear. Tympanic membrane is pearly gray, and there's no serum that's there's no redness, there's no drainage, there's nothing like that, so that is perfect as well. Next thing I'm going to do is I'm going to do the whisper test. I'm going to have her occlude one of her ears. So you pick. I'm going to say a word behind her.
Purple.
She's able to hear that. Now occlude the other ear.
Orange. Orange.
She's able to hear both of them appropriately, so that is good. Next thing I want to do is we're going to use a tuning fork, and we're going to do what we call the Weber test. I'm going to strike the tuning fork, place it on the top of her head, and she is going to tell me if she can hear it bilaterally in both ears.
Yes.
Good. So she can hear it in both ears, and that's appropriate. The next thing I'm going to do is I'm going to do the Renin test. I'm going to strike the tuning fork. I'm going to put it on her mastoid process behind her ear. I'm going to hold it there, and then once she can't hear that any longer, I'm going to hold it in front of her ear. Her bone conduction should be, or her air conduction should be twice that of her bone conduction. You can't hear it?
I think it stopped. I can hear it.
Awesome. So that's perfect. So air conduction is twice of bone conduction, so that's good. Next thing I want to do is I want to look at her mouth. So we're going to have her, first I'm just going to look at her lips. They're pink, they're moist, they're appropriate. There's no cracking, no redness or anything like that. Can I have you open up real wide? Perfect. The roof of her mouth, her soft and hard palate are present. They're pink and they're moist also. She has 28 teeth that are present also and no dental caries that I can tell. Can you stick out your tongue for me? Perfect. Can you lift it all the way up? Good. The floor of her mouth is fine too. Can you stick out your tongue again? Can you say ah? Her uvula and her tonsil are both present. Tonsils are about a 1 plus, so that's perfect as well. I am going to check her gag reflex. Can you stick out your tongue real quick? That is present as well. So those are all testing for cranial nerve. The other thing I am going to have her do is I want her to push her tongue against her cheek, and I'm going to apply pressure. So push against and push again. Perfect. Those cranial nerves being tested as well. So that's perfect. Um, the other thing I want to do while I'm on the head is I'm going to check for her lymph nodes. So we're going to do the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, the submental, the superficial clavicular, or cervical, the superficial clavicular are down here, and the infraclavicular are down here. Sorry. The superficial cervical are back here, and then the posterior cervical. Can you lean your head to one side? And then the deep cervical on the other side, and then the deep cervical. I'm gonna have you lift your arms up for me, and then the axillary. So those are all appropriate. They're not able to be felt, which is appropriate as well. So next thing I want to do is I want to test her arm strength or check her arms. Arms are fine bilaterally. The skin tone is fine. It's pink in color or tan in color. Um, there are some nevi places and their little age spots. She said that she has been watching them and the borders have not changed at all. You can just rest your arms down, and that's fine. I'm gonna check her fingernails. There's no clubbing. The capillary refill is less than 3 seconds, so that is appropriate. Also, I'm gonna have her squeeze my hands. Okay, I'm gonna have her go like this. Don't let me pull, and don't let me push. Okay, now just relax your arms. I'm gonna check her brachial pulse, interradial, and then we'll check her brachial, interradial. So that is all. That is all fine as well too. Next thing I want to look at is I'm just going to simply inspect her chest posteriorly and anteriorly. Um, or anteriorly and posteriorly. My bad. Sorry. Um, looking from the front, everything looks fine. The color is appropriate. Her respiratory rate is appropriate. There is no barrel chesting at all. If I come to the back, it looks the same way. The color is appropriate. There's no barrel chesting. All that's fine. Next thing I want to do is I just want to palpate the chest. No tenderness. Palpate the chest back here. And no tenderness. I'm going to percuss the costovertebral ankle back here. So I palpated it, and then I want to percuss, see if there's any tenderness. And there is none, so that is good. Next thing I want to do is I'm going to percuss the front of her chest as well. And then I'm going to percuss the back of her chest as well. And I go side to side, and then we're checking them bilaterally as also. Um, that all looks great. Next thing I want to do is talk about, or is check for tactile firmitus. So I'm going to have her say, go ahead and put it forward. I'm going to have her say 99.
99. 99. 99.
I'm going to have her do it the same thing in the back.
99. 99. 99.
There's a slight vibration, which is appropriate. That's exactly what we're looking for. I'm going to check for chest expansion. So I'm going to place my hands on on her posterior chest, and I'm just going to have her take a big deep breath in and fill her diaphragm. Big deep breath. Good. And out. Good. One more. Good. And out. My fingers moved about 3 centimeters, which is appropriate as well. The next thing I'm going to do is I'm going to do diaphragmatic excursion. So I'm going to have her lean forward. Just forward. There you go. I want her to take a deep breath in. So deep breath in and hold it. Okay, I'm going to mark that spot. Now breathe normal. Then I'm going to have her take a deep breath in and then exhale it completely. So deep breath in and exhale. And hold. And that change was about 4 centimeters also, so that was appropriate as well. Next thing I want to do is I want to just listen to her chest. I want to listen for um, any crackling, coarse, rhonchi, wheezes, things like that. Big deep breath. I'm going to go posteriorly, and I'm also going to do laterally while I'm back here. And I'm going from one side to the other to compare. I'm going to go laterally. Big deep breath still. And going back to the neck, I did forget one thing that I want to do really quick. So if you can look this up, I want to check her carotid arteries and her thyroid. If you note, there is no jugular venous distension at all, so that is a good thing. We don't want to see anything like that. So I am going to look. Hold your breath. Breathe. Hold your breath. And there's no thrills or bruise that are present there. I'm going to have her take a deep, big swallow. Good. And her thyroid is palpable, so that is good also. Okay, so going back to the chest, everything is appropriate there. There's no wheezing, there's no coarse, anything like that, so that's great. Next thing I want to do is I want to look at her chest as far as her heart. I'm just simply going to look. There's no pulsations or heaves, anything like that I can see. I'm going to feel for her pericardium, and it's absent of thrills or bruise also, so that's appropriate. I'm going to feel for the apex of the heart, the mitral. And it's the fifth intercostal space mid-clavicular line, and you can feel that. I'm going to listen to her. Listen to her aortic. Pulmonic. Tricuspid. Or no, I'm sorry. Aortic, pulmonic, herbs, point, tricuspid, and the apex and mitral. And those are all appropriate also. The next thing I want to do, I'm going to have her walk and lay on the bed. As she's walking, I'm just going to observe her gait and make sure that everything is fine still. She can walk normally. She doesn't need any help with anything like either. When she lays back, I'm just going to watch her muscle tone. Everything is appropriate in her muscles. Everything was appropriate in her stomach, and there was no problem like that. I am going to lift her shirt up just a little bit so that I can see. I just want to observe her stomach. I'm looking at the umbilicus. I'm looking for any pulsation, um, anything like that, anything out of the abnormal. I'm going to look from the side, and that all looks appropriate. Next thing I want to do is I'm going to listen. I'm going to listen to all four quadrants. You can listen up to 2 to 5 minutes, but for the sake of the video, we're just going to look or listen. Then I'm also going to listen to the arteries. There's gurgling in all four quadrants. I want to listen for the aorta, the renal, the iliac, and the femoral. Those are absence of thrill or absent of thrill or bruise, so that's appropriate as well. Next thing I'm going to do, I'm going to palpate. I'm going to feel for the aortic pulse, so I can feel that, and that's appropriate. I'm going to percuss, and I want to percuss for the splenic border and the liver borders. So I'm going to percuss. I can percuss for that. I feel that or hear that. There's that. And I'm going to come up. And her liver border is about 4 centimeters or 8 centimeters, so that is appropriate. That is what we're looking for. The next thing I want to do, I'm going to do a light palpation and then a deep palpation. No pain on the light palpation, so that is great. And then a deeper palpation. Muscle tone again is fine. Good. Can I have you take a deep breath in and exhale? I'm going to feel for that liver border, and that is present. I'm going to feel for the kidney over here. Big deep breath in and exhale. That is present. Another deep breath for the right kidney and exhale. Perfect. Can I have you roll on this side? I want to roll this way towards me. I want to feel for the spleen. Big deep breath. Alrighty. Now I can't necessarily feel the spleen, but that is fine. It's normal not to be able to feel it. So go ahead and lay back for me. Perfect. You can get up. As she's getting up, I'm just going to observe for her muscular strength. She's able to get up appropriately, but that's a little squishy, so sometimes it makes it a little harder. I'm going to observe her gait as she walks back too, so just to make sure that I'm double checking everything. Next thing I want to do is I'm going to look at her legs. Her legs look appropriate. She has a few bruises, which is fine. No nevi, nothing like that. Her skin tone is even throughout. No bulges, nothing out of the ordinary. There doesn't look like there's any edema in there, but I am going to feel for that. So no edema. I'm going to feel for her popliteal pulses. Good. Her tibial. Good. And her pedal pulses. Her dorsal pedis pulses. And those are appropriate. Her, oh, I'm sorry. I'm sorry. I felt for her popliteal pulses, her tibial, and her pedal pulses, all down there. I'm looking for cyanosis in her, or capillary refill in her toes, and that's appropriate also. Those are all appropriate. I'm going to have her push against my hands and then pull against them, and that is appropriate too. Next thing I'm going to have her, or we're going to do, I'm going to check for some reflexes. I'm going to do her brachial, her knee, and also her Achilles. So I'm going to look at her arm, just have it sit over like that and just let it relax. Her hand sprung up just a little bit, which is appropriate. That's what we're looking for. Just relax. All right, and her hand sprung up just a little bit, which is appropriate. Just relax your knees. That was appropriate too. Just relax your knees. That one was appropriate. Also, I am going to do the Achilles. That one was appropriate. And that one was appropriate also. Next thing and lastly, or one of the other things I want to do real fast is I'm going to have her stand up for me. I want to check her spine, make sure everything is in line. So go ahead and face that way. Perfect. I'm just going to look at her spine. There's no curvature. There's no signs of kyphosis or scoliosis. Go ahead and bend over for me. Perfect. And then lean back up. Perfect. Go ahead and bend to this side and then to this side. Okay. And then rotate this way. Good job. And rotate this way. And that's perfect. And I'm going to have you sit back down for me. One last thing that I'm not sure if I remember to do. I do want to do range of motion against her head. So I'm gonna have her put her chin to her chest and lean back and backwards, chin back, ear to the shoulder, ear to the other shoulder. Okay, perfect. Look to your left, look to your right. Okay, push against me, look forward, push against, and push back. Um, okay. Also to mention again, I did not notice any mouth odor whenever I was looking or listen or have been talking to her also. And that concludes my head to toe assessment. Thank you.